minutes of questions.
Thank you very much, Madam Chair, and I too support the principles of Ms. Matsui's bill. My family are consummate label readers. Ms. Zarecki, you know, you talked about, and you got to me because you talked about those moments when you go in to listen to your child breathing, and I did that many times, particularly with my older son who has lots of food allergies and breathing issues, including asthma. And so I know that feeling, and I'm so sorry. That being said, let me switch back to allergies, which is where I had planned on going, but you know, the testimony is very compelling. I like the bill. I do have some questions about it. I will tell you that you know, this is not something new, as you know. It's been around for a long time. My mother loves to still tell the story of when I was 5 years old. I got in trouble for a brief period of time because I threw a cookie across the room. They did not understand. I had and still have a wheat allergy. I knew I couldn't eat that cookie. And back in the early 1960s, they didn't have rice cookies readily available or you know, other flours. Everything had wheat in it, and I knew I couldn't have it, but the aide who had just been hired had no idea and kept handing me the cookie and said, no, this is for you. And finally, after having refused it several times, I tossed it across the room. I don't remember it, but my mother loves to tell the story. Likewise, and as a part of what I was thinking about when you were testifying, one of the greatest days of my life was when my son, my older son, he's now 14, he will be embarrassed and roll his eyes if he ever sees this, but he was about 2.5. We don't know to this day what he got a hold of, but something that we were eating at a restaurant, he got something he was allergic to. We don't know what it was. We heard the wheezing beginning.
Right.
We'd already turned the car around. My wife and I were already going to the hospital. And from the back came this little voice that said, Mommy, I need to see a doctor. The self-awareness factor is so important. And so I appreciate the bill that Phil Rowe and Steny Hoyer have put in, and Phil's had similar bills in the past. And they had actually had, and one of my concerns with the bill is that they had actually some requirements that you have medications in the schools, which I like. This one does not require that. Now, Virginia has epinephrine in the schools now, but, you know, if something were to happen, you know, that's step one, as you know. But one of the questions that comes up is the trained individuals. How much training would they need? Because I represent a district that has we're 422nd in household income out of 435 in the U.S. House. The school systems don't have the money to necessarily have a school nurse, an RN in every building. They have one somewhere in the system most of the time.
Sure.
So what kind of training would those folks need, and would it be so extensive that it would be too expensive for poor communities like the ones that I represent to be able to go forward?
I don't think so, and that's one of the things that we do with the CDC through their National Asthma Control Program. We publish materials on our website which are completely free for an asthma action plan, for an allergy action plan. So just having those, they're easily downloadable. You could get them on a lot of doctor sites as well. And then in terms of training, they're videos that we produced that walk you through what an asthma attack looks like and how to address asthma. So those are all free resources.
Some health teacher or somebody in the school could do these videos and qualify under the bill.
That's absolutely right.
All right, I appreciate that, because that would be a concern. I want those people trained. I want them to be aware, but I also don't want to, you know, price them out of the market or make it so that they can't meet the requirements.
Yeah, the legislation is great because it comes full circle. It creates incentives for schools to access some of the free materials that the CDC is working with other partners to address on a public health basis.
Now, let me get this on the record, too, because sometimes people will look at the language and then they'll get carried away. It says in the bill on page 3 that the schools have to have efforts to reduce the presence of environmental triggers of allergies and asthma. My son, my 14-year-old, is allergic to every tree in the east. I don't want anybody to interpret it. I don't think you mean to have it interpreted that they have to chop all the trees down around the school. Am I correct in that? Just make sure that they've got clean systems inside the school?
Yeah, that's exactly right. There's some best practices that you could do by looking at your air filtration. I mean, there's indoor air rugs in the classroom, that kind of stuff that you can manage. So it's not about cutting down trees, but is legislation locally that addresses idling school buses, for example, and idling cars. Those are things that you could do on a local basis to reduce fuel emissions that could trigger an asthma attack.
I appreciate it very much. My time is up, and I yield back.
Thank you.
The gentleman in the